not like nervous. I'm just like excited. I don't know. I am really excited to tell my boob. Whoa, whoa. Anyway, guys, I'll see you guys there. Okay, we made it to the place, but like they have even the doorbell, and like it's really hot outside right now, so I'm like dying of heat. It's so hot. Ugh.
All right, I got it started. So you can get start to finish.
I want to start opening these freaking packages.
Tell me about it.
Yeah, I have a bunch of these for my tube, because my tube likes to splurge out stuff a lot.
That's always fun.
It is, except when you get out the shower and hook up to a barrel bag and then everything just gets on your leg.
Yeah, great.
Yeah, it's perfect.
It's out of your way. Is this the same port that you've had since you were?
No. So they took it out after chemo, a year after chemo. And then they, can I have some hand sanitizer?
Yeah. Please
And then
do.
they just put it back in this year.
Do you
Okay.
have like? We used to have a little bottle here, but
Did you just wash my hands?
so when are you guys leaving?
Oh,
Wednesday.
Wednesday morning. What?
You don't have gloves on.
I hand sanitize my hands. I
Okay.
said I don't have to wear gloves, right?
Yeah.
That's like
I know. When I first started option care, I was like, no gloves for this stuff. Okay.
well, because also I don't have gloves right now. I only have a small.
Yeah,
So.
but we need to get the medium.
Yeah.
They have medium right here though.
Oh.
Yeah, if you want to have some. Yeah.
These kids are different than my kids.
And option care is the one that sends you all the supplies, right?
Yeah.
Do they send you a different one? Then?
No. I'm sorry.
Okay.
I mean like the kids in the hospital.
Oh, okay.
These are the gloves, I'm guessing.
So I was gonna say, were you gonna use this as a sterile drape?
Yeah.
So technically, since you touched it without sterile gloves,
Oh,
it's not sterile anymore.
That's good to know.
It's okay. That's why you're here. It's just little
So I
pieces.
don't use this then.
So yeah, we won't use that one.
These kids are different than my kids. This is weird.
So I will say the 1-inch border is technically dirty,
Okay.
and then
So you could just
you
fold
can-
it.
so what I would recommend doing is grabbing the masks, grabbing the sterile gloves, putting one set of sterile gloves on, and then you can like pull stuff out and like set this out so you know that this is for sure sterile.
Okay.
And then you can start dropping your stuff in it, and then when you're all done dropping your stuff, you put on like your sterile gloves you're gonna use to access.
Okay. That's why
makes
there's two pairs.
So let me just go get
So weird. Fuck, how do I put these on? How are they stuck to each
And
other?
I was gonna say the sterile gloves from the Cardinal Health kits kind of suck
Stuck.
because
Yeah.
they get stuck together.
Yeah, I'm learning that.
Here, I'll steal this because there's two more in here that fresh
Perfect.
ones. I'm sure they'll be stuck together too, but
Appreciate that. Yeah, I'm used to like the white ones.
that are actually like nice and thick.
Yeah,
and
and
don't,
they, yeah, and they like have like two, like one and then like kind of like separate. I
Yeah,
guess.
those are the nice ones. If you have those at home, definitely.
Well, in the kits that she's used to from the hospital, when you open it
They're
up,
labeled.
everything is open and labeled, so you don't have to worry about cross-contamination on anything.
That is nice. Oh, it's like the ones that fold out, right,
Yeah.
with everything? Yeah. Those are the nice ones. Alright, and of course I would grab one of these kits. So these gloves are actually backwards.
This is right.
Wait, Chanel, make sure
So
Not this one, right?
what I would do too is grab like the edges of this and kind of like pull it taut so that it's not like flapping over and killing each other.
Okay. And so then, is this the inside of said glove?
It is, yeah. So these are better, but let me just make sure then. Because these ones I've noticed are backwards. So the left hand is actually the right hand.
Oh, hold up. That's labeled wrong.
It is. It is.
Oh,
so that's like another thing to just throw your for a loop here.
Okay, so I could just like,
Yeah, you can pull that cuff down.
and then this is right.
Correct.
Hold up. There's like an inside. So I do put my hand inside of it.
You do, but with your palm facing out. And you can use your like dirty hand. It's okay. You can touch that cuff part back.
So the cuff part I'm allowed to touch.
Yeah. So you can use your left hand if you want to help a little bit to pull it down. There you go. Perfect. And just keep perfect. All right. Awesome.
Okay.
And now this is the one where you would use your sterile hand to like tuck it under the
This
cuff
one?
there. Mm-hmm.
Oh my god.
And it doesn't have to be perfectly on your fingers because once you get it pulled down, you can adjust your fingers.
My fingers are swimming.
There you go. Make sure with your sterile hand that you don't touch the inside. Mhm.
Yeah.
All right. The hardest part is just the gloves, honestly.
No, for real. Okay.
All right.
That's not tonight.
That was good.
Throw this one.
Yeah, we can toss that. And then now I'll let you take your drape out of here.
And the plastic part goes on the bottom, right?
Exactly. That shiny side down.
Okay. I'm like, which part is the plastic part?
And then it opens one more flap on that side. Perfect. All right, now you can like get your hands dirty again by opening up all the packages and dropping your stuff in.
When you say "and," you mean on here, correct?
Yeah.
Okay. I'm just double checking.
On your sterile filled. Having this table to this side is good because then you could drop your
Yeah.
stuff over here instead of there.
Oh,
The trash.
I forgot about that too. I feel like this is like backwards from like how J Hatch does it. Use that.
Yeah, you don't need that. So technically, you just contaminated that because you touched the outside of that packaging. So I would open this first
Okay.
because you're touching like the outside of that dirty packaging. Perfect. And then I would have taken like the outside of this and just dumped it into the center. And then you could have like picked out the stuff you don't need, like tape and whatever else. So that's fine because we still have this kit here.
Yeah.
So we'll just pretend.
So I just take the outside of this
Mhm.
and then just dump it. Okay, so that's something I need to learn. Okay. And then I just pick everything out, you said, or do I change gloves again?
So change gloves again, but before that, you
Open
still
the
have to
needle,
just
yeah.
drop. Yeah.
And
And
she
then-
needs to get that piece of paper off too, right? On the top there, the resource dressed in changing sand paper. This one.
Oh, yeah. And technically it's sterile, so
Yeah, it's
once
definitely
you-
that's sterile.
Yeah.
I thought. Okay, and then you open this.
hmm So pretty much open everything that would be like considered dirty. Drop it in.
Okay.
All right, so now you have everything you need. The main things to like, I guess people would forget is the clave. So you have the clave, you have the port needle, and you have the bio patch.
Yeah.
And then everything else should come in the kit. And then for you, you'd have the IV3000. That would be separate as well.
Okay. So then I take off the gloves.
That's right. And then now you can start picking out your stuff here.
I pick it out with fresh gloves, right?
Correct.
So these are sterile.
Mm-hmm.
Okay. So then I can put this packaging on here. Or no?
No, just because you touched it with dirty hands, which is fine, because really the inside of it is sterile. I would just set it here. I wish these tables were bigger. And when you do go to the hotels, I would honestly maybe do this on like a bed, like
Yeah.
maybe spray with like Lysol or something. And then I would like stretch it out so that's like a perfect rectangle, or else it is gonna start folding in. Okay.
And now, is it this one backwards too, or?
No, that one's normal.
Okay.
Are you left or right-handed?
I'm right-handed.
Okay.
Checkers.
You can hold this one down. Yeah, you can peel it apart there. That's inside of the cup. Perfect.
Oh, I could touch it with this. Yeah.
Mhm.
That makes that a lot easier. I can remember I can touch the inside.
Yes. There you go. Perfect. And now if you need to touch like the inside cuff of like this one with your sterile hand, you can.
Okay. So I could touch the outside though, right?
Mm-hmm.
Okay. This one sticks so badly.
Do you have more of those other kits that you're more used to at home, or is it just?
No, it's just the ones I watch in person.
Okay, good. So at least you're practicing with it now.
Oh. Yes, no. Fingers. Oh, come on. There we go. Okay.
Okay.
Ooh. Was okay? Okay, now I pick out everything I don't need.
Exactly, and you can toss it.
Can I toss it on here?
Yeah, that's fine.
I don't use that. Do I have to use this? Because I don't. Okay. I have no idea what this is even for.
A lot of the stuff is geared towards pick lines, so you can mostly toss all of it. I
I
don't.
do use this.
Do you use the stir strip? Okay.
This is not my patch. No.
Correct.
This is my patch.
Mm-hmm.
So this is iodine. So is this the one I'm wiping down with?
It depends. So you can either do an alcohol and iodine combo, or you can do a CHG combo, or just CHG by itself.
I'll do alcohol on this one.
Okay.
Okay, and then so this is CHG.
That's CHG.
Okay. Getting it lined up. So I'm assuming you do the alcohol first and then.
That's right. Some people will, because you know what, the betadine keeps your skin a little orange tinged. Some people will wipe it with alcohol after. I recommend not doing that because it defeats the
Just
purpose.
purpose, yeah. I don't know why someone would do that. That's odd. And that's this. Okay. Can you turn back on the?
Oh yeah. mean, if you need me to hold it like directly in front of you, I
it's
can.
Okay.
Okay.
Maybe. Hold up. There we go. Just a little bit. Yeah.
Okay.
There we go. Okay. Start in the center, right? And go out.
You'd start exactly where you're gonna poke and then go out.
Makes it easier. Is that far enough out? Yeah.
Yeah.
Okay.
Whatever would be under the dressing.
Do I use both sides?
No, you don't have to.
I set that over there.
While I'm doing it, sometimes I'll like kind of roll the swab too, like as I'm going out.
Okay. And then I start from inside again.
That's right.
Okay, this is also different than hospital. This hospital has that one that is just like the stampy one. I don't know what it
A
is.
sponge
Oh,
pad.
yeah.
Yeah, and then you just like kind of press it and like it just. I might have like both of them.
Well, that one has CHG. Did you want to use the
No,
CHG?
no.
Okay. I know the stampy one is so nice.
Yeah, I prefer not to use the CG because sometimes it makes my skin like a little itchy.
Oh,
I'm not like actually allergic to it though.
okay. Yeah, if we have the option, we'll avoid it.
Okay. Is that good?
You're doing great so far.
I could just remove that. So should I wait for the alcohol to like completely dry first and do that, or?
I would, and it dries pretty quick. Usually by the
Yeah,
time you
it
open
is.
the pack. The betadine will take a little longer to dry though.
The struggle is real with this one.
And remember, betadine spills and stains.
Thank you for that reminder, Mom.
Sometimes when I open it quick, it like will splash. I'm like, oh gosh.
Okay.
And then same method, you just start inside and go out.
I see where rolling the Q-tip would be beneficial because she's just really using the same dirtiness all over. So if you could twist it and roll it while you're doing it.
And then it'll kind of like get dry on the one side too.
It's hard for my wrist.
That EDS.
Oh.
I know, and also not like looking down like that. I feel like it'd be a lot easier for you if you like had a good big mirror to just be in front of. But you're doing good so far. Shopping list: get like a nice like light up cosmetic mirror.
If I could do it and then my face is different. It's hard to roll it. To get out here.
Yeah, you can kind of like go into like a square or a rectangle, like how the dressing would go. That's usually what I'll do like on the last one, is I'll start in the middle and then start to go out and then kind of like outline a rectangle where the dressing is going to be.
Okay. And now the last one.
And now I would go out bigger and then try to do that rectangle.
Like that.
Yeah.
that
There
good?
you go. Yeah. You hit the last little corner that I was like wanting you to hit.
I can remove that.
That's right. And then we'll let it dry real good.
Yeah.
For a couple minutes. Oh, there goes the base. I'm sorry, I'm not.
Oh, gosh, sorry.
You're fine. Trust me, the amount of times I've done that.
As long as it's not on her clothes, it's
Exactly.
okay. Yeah, this is the part that she drives nurses crazy about because they'll think it's dry.
I just like got an argument for the other day because I was like, she was like, "Can I access you?" I'm like, "No, it's not dry."
Yeah.
And she's like, "Oh, it looks dry." I'm like, "Well, it's not." And then next time she's like, "Okay, when you feel it's dry," I'm like,
Oh my
it's
gosh.
not, like it's dry or it's not dry. Like it doesn't matter how I feel. It's
It only
dry,
takes a
not dry.
couple minutes. It's not even
I
that.
know. And she was just staring at me. She was just like, I'm like,
You probably encountered so many.
bitchy.
Yeah, you said it.
She's
I'm
like,
on the
I
clock,
can't use that
can't.
No, there's some
That's
like
so
really good ones,
frustrating.
and then there's like some ones that like they don't want to be there. And I'm
Yeah.
like, why are you working in pediatrics?
Yeah, I know, especially in peds.
Mm-hmm.
Like, you already need to have patience and empathy to be a nurse, honestly. It's not just one of those jobs where you can just be like, oh, I'm just clocking in for a paycheck. You can't.
No.
Especially with her because she is simple. You know, there's no cry, there's no scream, there's no movement, there's no nothing. She just...
I just ask them for things to be done correctly.
Correct. Yeah,
Yeah.
exactly.
And she feels moisture because that's part of her EDS and things like that and her autism. Like, she feels it. So then it starts itching her and stuff like that. So it's like, no, just...
Mm-hmm. And if it doesn't dry enough, it's gonna itch under the dressing. It's gonna create a rash. Like,
But I try to explain to her that they could only go based on visual perception.
No, but like,
So-
look your attitude about me when I like tell you.
that's the part. And it's like, if they felt like, oh, okay, maybe it looks dry, but then the patient says, no, it's
Yeah.
not, I'm gonna respect them. Be like, okay, we'll wait a couple more seconds or whatever it is.
Yeah, it's definitely around like the actual like port. It's like show moisture.
Yeah, because if not, she does get a rash.
Mm-hmm. And they should know that policy. I was gonna say too, sometimes what I'll do is while I'm waiting for them to dry, you can start setting up your stuff and priming your,
The line.
yeah.
Is there like a proper way to take this out, or should I just?
I just kind of peel both sides, like split it up. There you go. That's really it.
I'm allowed to touch like this portion. Okay.
And then I usually unloop the little thing first and then pull it out.
Oh,
but
sorry.
Either way is fine, as long as you get it out. Once you do it more, you'll get like a flow.
I can put this back on here. Okay. So I wipe this with alcohol, like the end cap of it.
So you don't have to wipe that one with alcohol because all of
But
that is
this
still
one.
sterile. Well, that one's still sterile too.
Mm-hmm.
All you would do is take that white cap off
Okay.
and then put the blue clave on there. Because all of it was, oh, there's a little lid on the blue part too.
That shouldn't have looked.
I know, everything has lids and caps and everything. So all this stuff is sterile, so you shouldn't have to wipe any of that.
Okay.
Yeah.
Including this.
Correct, yeah.
I just pick this up and.
And you can get the little air bubble out. I would pull the plunger down first and then push up because it'll squirt out if not.
What do you mean? Like down like that?
Yeah. Pull back
Oh my god, this is difficult. Okay, like that.
and then push up and it should be easier.
Oh,
There you go.
Okay, I got the air bubble. Yeah.
Ah!
Oh, that requires some muscle that I did not know I needed.
I know, I've noticed the sterile ones are harder to get the bubble out.
Okay, I poured way too much. I underestimated that. I'm used to doing my tubes.
And then clamp it, right?
You don't have to clamp it, but it's not wrong either ways.
I'll clamp it just so I have the memory of clamping it. Okay. And then I could take that off.
Mhm.
And then I don't have to cap this because it's a clave, right?
That's right.
I got like my.
Your betadine.
that's
What
like-
I'll do sometimes too is take the extra alcohol wipe and I just kind of like rub it on my fingertips. Because like I'll have patients that use like a grip lock or something for a Hickman and they use betadine and I don't want to get their grip lock all orange. So I just.
So lesson learned, do that before you.
And some people think I'm crazy for doing that. I'm like, I just want it to look pretty.
But it's not gonna like hurt it, right?
No.
Okay. Actually, that's good enough. Okay, it's dry. So when I take this out.
Mm-hmm.
So I'm getting it right here, right?
Mm-hmm.
And I just like push in.
That's right. You just go right in at a 90-degree, like straight angle.
What's 90 degree?
Just perpendicular to you. So it would literally just go straight in like that.
Like that?
Yeah. And I would grab both sides of the port with your dominant hand.
Mm-hmm. Still.
And then, yeah, go straight in. It might be a little tricky just because of where it is, the mask. And
yeah, it's like.
do you want me to pull it down a little?
What?
The mask?
Yeah.
Okay.
It's like, I cannot see.
I don't know if that was helpful.
Yeah, no, it was.
Okay.
But I'm trying to get it right here.
Mm-hmm.
Right here, right there. Right there. Just like making sure I'm gonna get it in the right place. Hold up, I'm gonna reposition my hand. Come on, right that, is that, can I do it like that?
Yeah.
Okay.
Whatever is most comfortable for you.
This is weird. I'm gonna like be able to do it like that. Maybe I should
It
do
seems like your finger's gonna be in the way.
Yeah.
If that's easier, then just
Yeah, I
like
think,
that.
okay.
Okay.
Just get it in the right place. Ooh. No, I'm nervous. Oh my god.
That's okay.
Right there, right there, right there. Right there. Oh my god. I cannot tell the spacing. Did I get it?
Push the back of the needle in a little more, cause
This one?
yeah, if it feels like it's
Ah.
okay. Does it feel like it's in? I don't know if you can
Yeah.
tell. Okay.
It hurts. I don't think I put it in right.
Well, let's go ahead and we'll flush it and see.
I think you went to the side too much.
Yeah, I do think I went to the side too much.
I know the needle base is like kind of twisted a little bit.
Yeah, that's why I'm like, I don't know if I.
But the actual needle itself might be in, but let's flush it and see.
Ah, sorry.
It's okay. And if not, it's okay.
Yeah.
You're not gonna be.
Oh, fuck! I just dirtied this hand.
It's okay. We'll practice with sterile gloves. Alright.
Oh fuck! I just took
Yeah.
so too much.
Yeah.
Yep, no blood's coming out.
Oh! Did I do it? Do I need to redo it?
Let's see.
Pretty good.
Yeah, I mean, we're getting good blood return. How does it feel? Any pain or swelling in there?
Pain, but that's like normal for me.
Okay.
You think I'm good?
I'm not in your body. I have no idea, baby.
Oh fuck! I think I actually did it.
I mean, the blood return's pretty consistent, so I would say we're in. If
Okay.
it was me accessing, I would go with it.
You sure? Yeah. Well.
Does it feel like it's poofed up at all at the top?
Maybe. Yeah, I think maybe I should redo it. Maybe I'm just being schizophrenic.
Yeah, you could because it's your first time. You're
Yeah.
nervous.
Like, what do you think? Does it look okay?
I think it's in. I think it's in. Because I've gotten like scant blood return when I haven't gotten it in, but usually this much, there's no way that's just from like you missing. So I think we're in.
Okay. Like, positive, like, I'm good.
Yeah.
I'm not gonna, like, explode my port.
No.
Well, and the good news is, you know, you're going tomorrow to get the fluids added so they could recheck
Sure
it.
it's not, like, swollen?
No, I think we're okay here. Let me flush it again. And if it like looks like it's getting worse or anything, we'll take it out. But I think you're in.
I think I'm just like being so.
Yeah,
Yes.
don't doubt yourself. You did good. But before we put the dressing on, I'll have you just straighten out like the little base part of the needle. Yeah.
I don't know how to do that.
It's okay.
You just take it and twist. Kind of like you do your tube on your belly.
Mm-hmm. Oh, it's clamped. Duh. I'm like,
No.
Oh no,
sorry.
that was on me. I did clamp that.
Yeah, you would feel like pain and we'd see a lot of bubbling right now if it was not in. I
Think
do
you got
I
think
think
you're,
it feels weird.
But it may feel weird because you're nervous.
I think that you kind of went to like the lowest rightmost portion
yeah.
of it. It's like not dead in the center, but it's still in the little gummy part.
Okay,
Yeah.
like I don't need to like
I
your
don't think you need
because
to
like does
redo
feel
it.
like a little weird place. I don't want to like go home and something being wrong with it.
Well, if it
That's
starts feeling
fine.
weird, you could take it out when you get home, baby.
Yeah.
Go ahead and turn it.
I'm just like making sure.
It's okay. See, I think you're just like in the lower bottom corner of it, but you'd be puffed up a lot more from that second
Okay.
salmon flush if it
Okay.
wasn't in. Trust me, I've seen it when it's not in so much, and we flush it, and it's like, oh, okay.
And remember during chemo when they didn't get it in once, you were like, ah!
I'm just
Yeah, it would be burning.
no, it just like feels
Like
like pressure.
Yeah.
That's okay.
Yeah. I think when you put it into, you were going kind of slow, understandably.
Yeah.
And I think that's probably why it hurt more instead of just like a quick like doop.
Oh my god, professional. It's gonna do one. I think one will be okay. And do I need to use this? Because this like has the cushion. So they don't typically use that. Because like already has the cushion. Probably
Well,
should ask that.
how long are you gonna stay access for? Typically, do you?
Typically, it would just be because she does bolus, which is
Tomorrow.
2 hours. But since they didn't send us home with heparin and to give her that extra security because we're supposed to be at infusions tomorrow,
Mm-hmm.
I told her we
leave it
would
until Wednesday.
go to you would
Oh.
go to infusion tomorrow. You'd get your infusion, get de-access
Oh,
like you
okay.
always do, and then re-access again on Wednesday.
And tomorrow.
Okay.
She means like tomorrow morning. Like,
Yeah, tomorrow at 8:30.
Okay, I think it'd be fine then. This mainly is just to prevent infection. So if you were doing it or keeping it access for like more than really like 24 to 48 hours, I would definitely say to put one on there.
Okay.
So just so you know for the future, if you're gonna leave it longer than a day or two, I would throw one on
And
there.
how do I put it on though?
So I'll show you just because you're not gonna use it, so it doesn't matter if it's sterile or not. So see how you did that little base of the needle? It's kind of like flush to your skin.
Mm-hmm.
Instead of it being flush to your skin, you'd kind of like push it away from your skin a little more
Okay.
carefully because you don't want the needle to go out.
Yeah.
And then you would just kind of hold it, like open the
Yeah.
legs, and then drop it over the needle, and then
Okay.
it'll close.
So just like you do with your tube on your belly.
Okay.
Kind of like a split gauze.
So there's something in that, some antibacterial.
Mhm.
Okay.
Most of them have CHG. This one I don't think has CHG. Has something. We had CHG ones, and then they switched to those poly something. But it is an antimicrobial.
Okay.
Am I putting this on right?
So that is a little tricky. It's probably gonna stick together. That part I would take off last,
Oh, okay.
and I would take the one part off first.
This portion.
Yeah, we'll see if we can get it to where it won't stick together, but
Okay, so like
if
this.
not, I can get you a new one. So the sticky part is on 2. Here.
Okay, the sticky part.
So they're numbered.
Oh, okay. I see.
Yeah, but it might stay to itself.
Oh, yeah.
That's okay. So this is. So
Yeah.
if you want to take this. All right.
And-
Now peel off one first,
This one
Mhm.
off first. Okay.
and then flip it over,
Like this.
and then peel 2 off, and then leave like that border on there. There you go. Perfect. And now you can like grab it.
Okay.
push it around your port area first.
Mm-hmm. And honestly, it might be lifted a little bit still, and we might have to kind of like pinch it at the bottom.
So. Like that?
Yeah. And then pull that. Here, I'm just gonna. Now you can press the sides, and then we can secure it around the port once we're done, because it's gonna.
What do you mean, like take this off?
After you get it all pressed.
Yeah, I would press down like the borders of it.
Is that good? Or
Yeah, that's fine there, and then I would just.
oh, you mean like, oh, hold up, let me do this side.
The top got a little crinkled, but
Is that okay?
we'll see how it looks when we take the border off. If anything, we can put another one over the top of it or something.
Push up that top corner. There you go.
Sorry. I mean, it's secure. It's not super pretty, but for your first time.
Yeah, I mean, I don't care about it being pretty. Okay.
But let's go ahead and just so it doesn't like start peeling. I know you're only keeping it in for a short amount of time, but I'll just pop another one over top it. So with this,
Oh, no.
with this steri strip, has your port needle like popped out before a little bit?
Mm-hmm.
You just like to put on there for like extra security.
Yeah.
Mainly because she's gonna, go home and go to sleep tonight. But typically, she doesn't use the
it's
steri
just,
strips.
like, for a couple hours.
But since we'll be doing things like driving while she's doing stuff like that, she just wants to be extra.
Like, you're sure the needle's in there good, right?
Yeah, I'll flush it again for you, and just to be sure.
And once again, Chanel, once you get over the anxiety of, oh my God, I actually did it.
I think it's because I put it in so low now. I'm just like, did I like...
But you're not putting anything into it. So when you go tomorrow to infusion, they'll be able to take a look.
Okay.
So then you'll have double medical confirmation.
Yeah. And they won't infuse. Are you getting hydration?
Yeah.
Okay.
Bolus. 2 boluses.
Okay, now that's on. I can take this off.
Okay.
Beautiful.
And I can like flush it.
Yeah.
Just grab like a flush.
Yeah, go ahead. I'm surprised. Here, go and wipe it first.
Oh, sorry. Maybe 30 seconds.
15 is fine.
Oh, okay.
Sing the happy birthday song.
Just kind of like do it up. How long that's been? Okay, I feel like that's been 15 seconds. Muscle time. And I just like flush it and then pull back.
You can do like a couple pumps and then pull back on it.
Muscles.
Yeah, you're so good.
Okay. No, I just like flush it back in. Okay. I'm just gonna leave it like that. Is that okay?
Yeah, are we gonna heparinize it?
Yes.
Yeah.
Okay.
Some more? Or?
You can do a little more. I just want to clear out as much blood from the line so that it doesn't get clotted up, but the heparin will do that. So You can take it off now if you want.
On the headband.
See, for her, it's not the fear of the needle itself, it's the fear of making sure she does it right.
This is an alcohol pad, right?
It is, yep.
My shoulder hurts. I don't know what I did.
Probably the like weird angles that you're.
Also, I have a knot in my shoulder too.
Oh. Yeah,
I think it's more that. I have to like realize I had this pain before I came in, so like.
Exactly.
Yeah, you did good, and we would not still be getting good blood return. Trust me, I've.
No, I do. I'm just like very like, oh my god.
She just can't believe that she did it by herself the
Yes.
first time.
I know. I'm excited for you.
Yeah, she has to do it because I can't.
No,
I
she
know.
can't.
I was gonna ask them like, has anyone ever tried to train you, or
Nope.
have you tried?
Nope.
She won't. When I had to lance my finger, she wouldn't even touch the lance.
Yeah.
Nope.
Do I need to prime this too?
Yeah.
Okay, that's what I thought.
Nope. She's my youngest of 5, and the first 3 I had completely natural because I don't like needles.
I
Yeah.
primed way too much out. Is this still okay?
Yeah, that's fine.
Okay.
You can do that same trick with those two, like pull it down.
Yeah.
And push up.
I didn't realize that. You live and you learn. Oh, muscle time. I never realized what the one like lady I follow has like really good muscles. Oh, this is why. So should I be pushing this at like a certain rate, or
No,
just?
you can just like kind of pulse it in. Push, pause, push, pause. Whatever feels right. Yeah, the needles, that would.
Even finger pricks used to make me pass out.
Yeah.
But she's taught me to be a big girl.
I just lock this.
Mhm.
Should I like do it like clean it off again before I put that on, or is
You
it
don't have to, but if it makes you feel more comfortable, you can. Ah.
okay? I feel like this is fine. It has alcohol on it. So at least it does blue caps. Would that be okay?
They should all have a little alcohol.
I did it.
Thumbs up. Let me see it one more time.
You got a photo?
That's like saying your first floor access
Oh.
on your own.
No. Oh, I broke the mask.
And you did it. You got it first try.
Alright.
And now we finna get Papa. He seems so cute.
That sounds good.
Hey guys, I just got done with my first 4 access. I got it on the side of it, but there was blood return. Okay,
Good blood return.
good, lots of good blood return. Oh, holy cow! I'm just like a very nervous person, so I've asked her like 15 times, like, am I good to call? She's like, you're fine. It was great blood return. It just like hurts because you know, I did it myself, and also I got
So
it
you're
on
hyper aware.
and also I
it.
got it on the side, so I need to like practice getting it like more in the dead center than the side.
Don't
but-
put your needle in like you drive.
Yeah, exactly. But she said I did a great job. I definitely did like F up a couple times, but it's because like the way like these pockets are different than the way I'm used to seeing them. So I'm sure over time I'll be a bit more cautious and sanitary.
I mean, even
But-
nurses mess up.
Exactly, you know, I'm not the only one. And for it being like my first official time, I feel like I did really well. And I'm really proud of myself, so yay! Okay guys, I never like did an ending to this video, so this is the ending. I'm home, my port is still very good. It's in good condition still. I didn't break anything or anything. But I will say I'm like a little nervous because this is like my first time since I was like 10, like 9 actually, being like left like overnight like in my own house with a port. So it's really weird for me. But anyway, I hope you guys enjoyed this video. I know it's very long, so thank you for anyone who watched all the way through, and if you did, put a heart emoji, a pink heart emoji in the comments so I know you watched it all the way through. If you like this type of content, don't forget to like, subscribe, and comment for more. Bye. Thank you.